Well, today the CDC panel will meet to discuss vaccines currently recommended for children. It comes following criticism when Robert F. Kennedy Jr. replaced several members of the advisory panel. ABC's Nicole D'Antonio with details.
This morning, an advisory panel at the CDC kicks off a two-day meeting where members are expected to discuss and vote on vaccines currently recommended for all children, including those for measles, mumps, rubella, chickenpox, and hepatitis B. The COVID vaccine also up for discussion. Such a meeting rarely draws attention, but Health Secretary Robert Kennedy recently replaced members of the panel, and many of the new members have questioned vaccine safety or spread misinformation about vaccines. Yesterday, former CDC Director Susan Menares told a Senate committee that Kennedy fired her after less than a month on the job because she refused to pre-approve new vaccine recommendations without evidence.
And he said and elaborated on this for some period of time that there is no data and evidence, there is no science, and that I needed to commit to signing off on each and every one of those recommendations. And if I could not commit to that, I needed to resign.
To be clear, he said there was not science or data, but that you still expected you to change the schedule.
Correct.
Health Department officials say her testimony contained factual inaccuracies and left out important details and accused Menares of acting maliciously to undermine the president's agenda. Following the testimony, Republican Senator Bill Cassidy, who's also a doctor, shared this warning for parents.
If the vaccine advisory panel makes recommendations to change the childhood vaccine schedule, should the American people have confidence in that decision?
No.
Democrats also voicing concern.
Robert F. Kennedy Jr. must resign. We have to turn him into a healthcare pariah in order to make him a detriment to the Trump administration. And I think that's the only way, ultimately, that we're going to save the lives of children and adults in our country.
Several major medical groups warn any recommendations shifting vaccine schedules or eligibility could spark more confusion, trigger shortages, and potentially cost lives, pointing to a measles outbreak this year that killed 2 children. Nicole D'Antonio, ABC News, Washington.